Swastiastu. We are from SGDB1 PSSKPD 2020 Semester 2. In this occasion, we are going to present our student project entitled Drug Usage in Children with Enterobiasis. Next. And this is our group members. Next.
Hello, my name is Dewa, Fony, Prema, Shanti, and I would like to explain Chapter 1 Introduction. Next. Indonesia, with a tropical climate, fertile land, various economic status, and settlements, knowledge of health, and many of these factors are in low category. These phenomena causing a high number of diseases, especially worm disease like enterobiasis. Enterobiasis, or also known as pinworm infection, is a parasitic infection commonly found in children. This disease is caused by Enterobius vermicularis, or parasitic pinworm. The incidence of enterobiasis tends to be higher in children aged 6 to 8 years and is still an important health problem in children of primary school age. Based on Williem reports, the Minister of Health said that around 60% to 80% of school-age children in Indonesia have worms. Hartanto also report that several areas in Central Java still had a fairly high prevalence rate of enterobiasis, namely around 58% to 74%. Based on the background, we are interested to discuss about drugs usage in children with enterobiasis. Next.
Hello, my name is Darren. Based on the background, we are interested in discussing about drug usage in children with enterobiasis. So the problem formulation of our student project includes how is the infection of Enterobiasis vermicularis, how are the profiles of different enterobiasis drugs, and how are the enterobiasis drugs prescribed as therapy for children. And the purpose of our student project is to give information about Enterobiasis vermicularis infection in general, to give information about the profiles of different enterobiasis drugs, to give information about enterobiasis drugs prescribed as therapy for children. And the benefits that we hope the readers will get is that our student project will give general information about Enterobiasis vermicularis infection, especially in children, to give general information about the profiles of different enterobiasis drugs, and the last one is to give general information about enterobiasis drugs prescribed as therapy for children. Next.
My name is Nindya, and I will explain about the infection of Enterobiasis vermicularis. Enterobiasis is a disease caused by parasitic pinworm infection named Enterobiasis vermicularis. It has a thread-like appearance, small and whitish color. Meanwhile, these eggs have 2 layers and elongated oval shape. Next. Enterobiasis is often found in children, but it can also occur in adults. Tropical climatic condition and poor sanitation also increase the risk of enterobiasis transmission. The transmission of enterobiasis usually occurs by autoinfection via the fecal-oral route and also possible by inhalation or retroinfection. After a person swallows infective eggs, the larvae hatch in the small intestine. Then it grows into adults and place themselves in the large intestine, usually in the cecum. At night, female worms move to the anus and crawl on the skin around the perianal area and lay their eggs there. That's why the main symptom of this disease is usually anal itching, mainly at night. Next. Diagnosis of enterobiasis can be done by identifying eggs in the feces by stool examination, perianal swab, or looking for adult worms. And to treat enterobiasis, it is necessary to provide therapy with appropriate antihelminthic drugs, such as mebendazole, piperazine, parental pamoate, and albendazole. That's all from me. Next.
My name is Karina, and I will be explaining about mebendazole. Mebendazole is a commonplace, wide-range benzimidazole utilized for over 40 years in people to treat an assortment of parasitic infections, such as Enterobiasis vermicularis. Mebendazole acts by restraining the creation of microtubules through restricting the colchicine-restricted site of beta-tubulin, and in this way obstructing polymerization of tubulin dimers in the intestinal cells of parasites. The most common adverse effects accompanying mebendazole use are loss of appetite, abdominal pain, diarrhea, flatulence, nausea, vomiting, headache, tinnitus, and elevated liver enzymes. In the state of overdose, gastrointestinal symptoms, e.g., nausea, diarrhea, vomiting, and abdominal pain may occur. Mebendazole is contraindicated in children below the age of 1 year for the mass treatment of single or mixed gastrointestinal infestations because of the risk of convulsion. For pregnant women, as FDA classified mebendazole as category C drug, and for lactating women, as there is traces of mebendazole in breast milk. Next.
Hello, my name is Sandy and I will explain about piperazine drugs profile. Piperazine is an antihelminthic drug that used to treat parasitic infections caused by worms. Piperazine very effective against Ascaris lumbricoides that cause ascariasis and Enterobius vermicularis that cause enterobiasis. Piperazine should be used by all family members because Enterobius vermicularis is easily transmitted. Piperazine available in hexahydride and many salt forms that is easily absorbed and can reach maximum plasma levels in 2 until 4 hours. Piperazine works exactly same as parental palmate by paralyzing worms and expelling them alive with normal peristaltis. The mechanism of action is by depolarizing the worm muscles and increasing the frequency of impulse. Piperazine will act as an agonist at GABA receptors and inhibit the acetylcholine esterase enzyme, thereby blocking acetylcholine at the neuromuscular junction. Therefore, the worms will die spastically due to the increased contractions of the worm's muscles. The most common side effects is mild gastrointestinal irritation. The mild side effects that sometimes occur are nausea, vomiting, diarrhea, abdominal pain, dizziness, and headache. Side effects that are rarely found are allergic reactions and central nervous system disorder in the form of temporary ataxia and seizures. If you are overdosed by piperazine, you will experiencing muscle weakness, vertigo, difficulty speaking, and confusion. But the symptoms will disappear when the treatment is stopped. Piperazine is a category B drug, which means studies have not found any adverse effect on fetal development. But piperazine should not be given to pregnant women, patients with impaired kidney or liver function, or patients with a history of epilepsy or chronic neurological disease. Next.
Hello, my name is Raka, and I will explain you about parental pain. Parental pain is an anthelmintic used to treat intestinal pinworm, example, Enterobius vermicularis. Next. So this is the dosage forms. It consists of 4 forms. There are, three forms: tablet, caplet, and suspension. Next. So this is single dose administration based on summary report EMEA MRL 14196 in 1998 is stated as a single oral administration of blue labeled parental pain. This drug is poorly absorbed from the intestinal panel or small intestine, so it is only used in a single dose. Parental pain divided into 2 dosages, depends on its package. It is used in single dose effectiveness. Okay, next. Parental pain is recommended for pinworm infection because of Enterobius vermicularis, or as we know as Enterobiasis. Parental pain works as an agent, inhibits neuromuscular immature pinworm to the other pinworm on the GI tract. Therefore, it will release acetylcholine and suppress cholinesterase, give a great impact in pinworm weaknesses. Okay, that's all from me. Thank you.
My name is Winnie Chandra, and I'm going to explain about the albendazole. The most common treatment for enterobiasis infection is albendazole, which has also been used as an anthelmintic for more than 30 years. The pharmacokinetics of albendazole are well absorbed in the gastrointestinal tract when taken with high-fat meals because the solubility of the drug is low in water. The drug is metabolized in the liver to form an active metabolite, namely albendazole sulfoxide, which has potent anthelmintic activity, and it is excreted into the urine and feces. The albendazole sulfoxide can inhibit tubulin polymerization, causing decreased glucose intake and glycogen stores, so that the production of adenosine triphosphate decreases, which results in energy depletion, immobilization, and death of worms. Next. There are some side effects that have been reported after the use of albendazole, such as vomiting, diarrhea, gastric pain, loss of hair, sore throat, cough, chest pain, blurred vision, jaundice, anemia, hematoma, thrombocytopenia, pain in muscles and joints, itching, fever, seizure, somnolence, allergic reactions, and so on. Some drugs that can cause drug interactions with albendazole are dexamethasone, praziquantel, cimetidine, theophylline, and ritonavir. Next.
Hello, my name is Dewi and I will explain about the Enterobiasis drug treatment. First is mebendazole. Mebendazole is a medicine that used to treat worm infection, the digestive tract. Mebendazole has high effectiveness against intestinal nematode infection and it's mainly used to treat mixed worm infection. One of the conditions that can be treated with mebendazole is pinworm infection or enterobius. Mebendazole effectiveness in treating enterobius vermicularis worm infection is more than 90% success. Mebendazole is a drug that recommended for adults and children over 2 years old. Mebendazole dosage in enterobius infection for adult patients and children over 2 years of age is mebendazole 100 mg orally as a single dose. If needed, mebendazole can be repeated 2 until 4 weeks later. Mebendazole usually takes about 3 days treatment time and the time it takes to cure the infection depends on the health condition of the patient's response to the treatment. However, if the infection has not cured within 3 weeks, it will be best to see the doctor. Therefore, the doctor could recommend other worm medication that is more effective and safer for the condition.
My name is Mira, and I'm going to explain about enterobiasis drugs therapy for children through piperazine. First of all, through granules for oral solution for children 2 years of age, the dose must be determined by the doctor. For 2 to 8 years of age, give 2 grams once a day for 1 day, and for 8 to 14 years of age, give 2 grams twice a day for 1 day. And for oral suspension, for children 2 years of age, give 600 milligrams every 4 hours for a total of 3 doses in 1 day. And for children 2 to 8 years of age, you can give 1.2 grams every 6 hours for a total of 2 doses in 1 day. And for children 8 to 14 years of age, you can give 1.2 grams every 4 hours for a total of 3 doses in 1 day. And both of these ways can be repeated in 2 weeks. The third form is for tablet form. So the usual dose for children is 65 milligrams of piperazine hexahydrate per kilogram of body weight per day for 7 days in a row. And for tablet form can be repeated in 1 week. And the side notes for children is that if the child misses a dose, take it as soon as possible. Do not let the child take double doses. Well, that is from me. Thank you very much for your attention. Next.
My name is Sadam. I would like to explain the enterobiasis drug therapies for children to pyranol pomade. Pyranol pomade is the therapy of choice beside albendazole and mebendazole work by blocking neuromuscular depolarization, inhibiting cholinesterase, and causing spastic paralysis in worms. Pyranol pomade is most widely used drug, is easily available, and is available at health center where patients seek treatment. This drug is known by wider community in Indonesia as well as in several other countries such as in Australia, Canada, and Europe under the trade name Combantrin. In case of enterobiasis, the treatment can be repeated after a time interval of 2 weeks. Next. The recommended single dose is 10 milligram orally. Therefore, it's advisable to check yourself approximately 2 until 4 weeks after the initial dose of the drug is consumed to determine whether a second dose is needed or not. That's all for me.
Hello, my name is Williem, and I'm going to explain about albendazole therapy for enterobiasis. Albendazole is one of many kinds of drug that has a role as antihelminthic that can be used against many infections such as Ascaris, enterobiasis, trichuris, strongyloidiasis, trichinolosis, and also hookworm infection caused by Acyclostoma duodenal and Necator americanus. However, the use of albendazole to cure enterobiasis also need a guidance such as dosage, duration, frequency to ensure that a patient will get the therapeutic benefit from the drug. For children under 6 months and adult, a 400 milligram dose with single frequency need to be administered. However, for children over 6 months but have weight under 10 kg, need to be given 200 milligram with single dose. The time span between the first and second dose need to be at least 2 to 4 weeks in the event of using this drug to cure enterobiasis. Next.
My name is Widya and I would like to explain about summary. Next.
Enterobiosis is a disease caused by a pinworm parasitic called Vermucula enterobius. Cases of enterobiosis are found mainly in children and rarely in adults, and the diagnosis of enterobiosis can be carried out in two ways. First one, identification of eggs in the stool by a saline smear and also a perianal swab using adhesive tape. Enterobiasis rarely cause serious complications, but only irritation, anal scratching, or insomnia because the main symptom is only anal itching, especially at night. Enterobiasis can be treated with antihelminthic drugs such as mebendazole, piperazine, parenteral pamoate, and also albendazole. Next. Okay, for the first antihelminthic drugs, mebendazole works by limiting the formation of microtubules by restricting the site of beta-tubulin to the site of colchicine. The second and the third is piperazine and also parenteral pamoate are another choice of drugs with the same mechanism by acting as a neuromuscular immature pinworm agent to other pinworms in the GI tract. And the last one is albendazole, works because of the main active metabolite called albendazole sulfoxide that inhibit tubulin polymerization, which causes selective degeneration of formed cytoplasmic microtubules. Next. For the therapy for children, mebendazole for enterobiasis is consumed orally for children over 2 years in dose of 100 mg as a single dose and can be repeated 2 to 4 weeks later. For piperazine has 3 types of drug forms, such as granule for oral solution, oral suspension, and also tablet. The dosage for each form is based on the child's age or body weight, and the treatment may need to be repeated in 1 to 2 weeks. For parenteral pamoate drug, single dose is 10 mg per kilogram body weight, but it only kills the adult worms in the intestines, not the immature eggs or worms. Hence, it will not protect children from recurring enterobiasis. And the last one is albendazole therapeutic treatment can be given in age under and over 6 months. For children under 6 months, can take a single dose of 400 milligrams, and for children over 6 months with weighing less than 10 kilograms, need to take 200 milligrams in a single dose. Next. This was the reference that we use for our paper. Next. Next. This is the end of our presentation. Thank you for all your attention. We apologize if we made any mistake, intentionally or unintentionally. We will close this presentation with Parama Shanti. Om Shanti 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 Om.